All right, strap in, everybody. We're about to take a deep dive into something we literally couldn't live without, the musculoskeletal system.
That's right. And we've got a mountain of sources here talking about everything from assistive devices like canes and
The
crutches.
injuries, like the ones that make you cringe just thinking about them.
Oh, yeah, we've got those. And then we get into some conditions that sound like they're straight out of a medical textbook.
Plus, how doctors figure out what's going on, and even a little bit of skull-bone terminology just for fun.
It's going to be a wild ride through the world of bones, muscles, and all the things that can go right and wrong with them.
So, to kick things off, let's talk about those times when our mobility needs a helping hand, literally. The source material mentions something about measuring a cane to line up with a specific spot on the hip, the greater trochanter.
Right, right. The greater trochanter. That's important because, well, think about it like this. You want that cane to act like a really solid support beam,
Yep.
right?
Yeah, makes sense.
So that greater trochanter, it's a key anchor point. Aligning the cane with it creates a direct line of support, distributing your weight evenly.
So you're not wobbling all over the place.
Exactly. Less strain on your joints and much more stable walking. It's all about biomechanics.
It's fascinating how something so simple can have such a big impact on stability. And I'm guessing the same principles apply to crutches.
Absolutely. Crutches, they work in pairs to distribute weight, and the height is crucial. Too high, and you're putting pressure right on those nerves in your armpit.
Ouch, that's got to be uncomfortable.
It can be. Tingling, numbness, even weakness in your arm, not good.
It's a good reminder that even those simple assistive devices, they need to be adjusted correctly. Safety first.
Always. It's about working with your body, not against it.
Okay, let's switch gears a bit and talk about, well, the not-so-fun stuff. Injuries. I think we've all heard of sprains and strains, but I'll be honest, I sometimes mix them up.
Happens to the best of us. Think of it this way. Sprain ligament, strain muscle, or tendon.
So sprain is like stretching or tearing the rubber band that holds bones together.
Yeah, the ligaments. And a strain, that's when you overstretch or pull a muscle fiber. Or, the tendon that connects the muscle to the bone.
Like pulling a hamstring, right?
Exactly. Both are painful, but knowing the difference helps with, figuring out the right treatment.
And speaking of treatment, what about that RICE protocol? It's like the go-to for sprains, but why is each step so important?
Rice. Good old rice. Rest, ice, compression, elevation. It's like a four-pronged attack on inflammation and pain.
A coordinated team effort.
Exactly. Rest gives those tissues a chance to mend. Ice, it constricts blood vessels, reduces swelling. Compression, it's like external support. And elevation helps drain that excess fluid away.
Like a well-oiled machine working to get you back on your feet.
Back on your feet, yes. But sometimes injuries are a bit more dramatic than a sprain. Our source material actually uses this analogy. Imagine a puzzle piece popping out of place. That's kind of what a dislocated joint is like.
Ooh, that image is a bit unsettling.
It is, and it can be quite serious. Those bones are out of alignment, which can damage ligaments, tendons, even nerves. Definitely not something to ignore.
Absolutely. Straight to the doctor with that one. Okay, this one sounds a little scary, and I got to ask about it. Rhabdomyolysis. What is that exactly?
Rhabdomyolysis. Well, it's basically when muscle fibers break down. It can happen from things like a crush injury
Oh, wow.
or even a really, really intense workout. And the problem is the stuff from those damaged cells leaks into your bloodstream.
And that's bad because,
You mess with your kidneys. Bad news for your kidney.
so too much time at the gym could lead to kidney problems. Yikes.
It's not super common, but it shows how important it is to, listen to your body, recognize the warning signs.
So what should we be looking out for? Any red flags?
Well, one strange symptom is if your urine is dark, really dark, reddish, or even like cola.
Cola-colored urine.
That's
That means there's myoglobin in your urine. That's a protein from the damaged muscles, and it's a big warning sign. So, rhabdomyolysis. Definitely something we want to avoid. Now let's talk about something a bit more familiar, though still not fun. Fractures. I was surprised to learn that they're not always from a direct blow.
Right. A direct impact is common, but you can also get a fracture from twisting forces, even strong muscle contractions.
So even without a dramatic fall, you could end up with a broken bone.
It's possible. Think about athletes who make sudden movements or people with conditions that weaken their bones. They might be more susceptible.
Makes sense. Now, the source material mentions a couple of complications that sound pretty scary. Compartment syndrome and fat embolism.
Yeah, those are serious, but thankfully not that common. Compartment syndrome, think of it like this. Pressure builds up inside a muscle compartment, usually from swelling after an injury.
Okay, I'm following.
And that pressure, it can cut off blood flow to the muscles and nerves.
So it's not just the broken bone itself, but what happens afterward.
Right. And the pain, it can be excruciating and doesn't respond to normal painkillers. If that pressure isn't relieved, it can lead to muscle damage, even paralysis.
Definitely a reason to seek immediate medical attention.
Mm.
Now, what about fat embolism? How does that happen?
Fat embolism. Well, it happens when fat droplets from the bone marrow get into the bloodstream, usually after a fracture.
The bone marrow, the stuff inside our bones, it gets into the blood.
It can, especially after a fracture in a long bone like the femur. Those droplets can travel to the lungs, the brain, other organs, causing all sorts of problems.
Like a chain reaction. The source mentions tiny red or purple spots on the skin as a possible sign. What's the connection there?
Those are called petechia, and it's a sign that those fat droplets are making tiny blood vessels leak. Not a foolproof sign, but definitely something doctors pay attention to.
It's amazing how seemingly small details can be clues to what's happening inside the body. Before we move on, can you quickly explain the difference between Buck's and Russell's traction? The source material mentions both.
Sure. Think of traction as a gentle way to pull and align a broken bone to help it heal right. Buck's traction is often used for thigh bone fractures, uses weights to create that pulling force.
Okay, I'm picturing it.
Russell's traction, it's similar, but it uses a sling under the knee for extra support. A slightly different angle of ball.
So it's like a carefully calibrated tug of war to get those bones back in place.
A very careful tug of war.
Now, let's shift gears a bit and talk about some conditions that affect the musculoskeletal system in a different way. Inflammatory disorders. And we'll start with the big one, rheumatoid arthritis. What makes RA different from other types of arthritis?
Well, RA, it's not just wear and tear on the joints, it's an autoimmune disease. Meaning, your immune system, the one that's supposed to fight off bad guys, it starts attacking your own tissues, including the lining of your joints.
So your body's basically fighting itself.
Exactly. And that makes it a lot tougher to treat. It's not just a localized problem, it can affect the whole body.
So how do you even begin to treat something like that?
It often requires a multi-pronged approach. The source mentions a bunch of different medications. DMARDs, anti-inflammatories, even anti-malarial.
Antimalarials for arthritis.
I know, it sounds strange, but certain anti-malarial drugs can actually help manage the inflammation in the marrow. We're not exactly sure how they work, but they do.
It's amazing how much we're still learning about the human body. Okay, another inflammatory disorder, osteomyelitis. What is that in a nutshell?
Osteomyelitis, it's an infection that gets into the bone. Can happen from an open wound, an infection in the bloodstream, or even spread from a nearby infection.
And the source material mentions that if it gets bad enough, you might need surgery.
Yeah, sometimes surgery is necessary to clean out the infected tissue, prevent further damage. It's a reminder that even what seems like a minor infection can become serious if it reaches the bone.
And good nutrition is crucial for treatment, right? The source emphasizes that.
It is. Think of it this way. When you've got an infection, your body's fighting a battle. And it needs the right fuel, the right building blocks to win that battle.
So a high-protein, high-calorie diet gives the immune system a boost.
Exactly. Fuel for the fight. Now, let's dive into some conditions that are often associated with aging. Degenerative disorders. We'll start with osteoporosis, the silent disease, as they call it.
Silent, huh? Why is that?
Because you often don't have any noticeable symptoms in the early stages. You might not even know you have it until you have a fracture from a seemingly minor fall.
So it's like a weakening foundation that you don't notice until something collapses.
Good analogy. That's why bone density testing is so important, especially for, women after menopause, older adults.
Makes sense. I was also surprised by some of the risk factors, like being underweight or drinking a lot of alcohol.
Right. Well, it's all about that balance between bone breakdown and bone building. Being underweight can mean lower bone density to begin with. And alcohol, it can mess with calcium absorption, the process of building new bone.
So it's not just about age, it's about lifestyle choices that can impact bone health. The source also mentions a medication called alendronate. How does that fit into the picture?
Alendronate, it's a type of drug called a bisphosphonate. It slows down the cells that break down bone, like putting the brakes on bone loss.
Fascinating how we can target those specific processes with medication. Now let's talk about osteoarthritis. How is it different from RA?
Okay, so RA is that autoimmune attack we talked about. Osteoarthritis, it's more about wear and tear on the cartilage.
Cartilage, that's the cushioning between our bones, right?
Right. And over time, that cushion wears thin. The bones start rubbing against each other. Pain, stiffness, limited movement. Not fun.
Not fun at all. The source mentions some specific signs. Heberden's and Bouchard's nodes. What are those?
Those are bony bumps that can develop on your fingers. Heberden's nodes, they're on the joints closest to the fingertips. Bouchard's, those are on the middle joints.
Got it. And I noticed that the source lists a variety of treatment options. Medications, assistive devices, even alternative therapies like massage.
Right. Because osteoarthritis is progressive, the focus is on managing the pain, improving function. Assistive devices help reduce stress on the joints, and those alternative therapies can help with pain and stiffness.
It's about finding what works for each person.
Individualized approach, absolutely. Now, this next topic might be a little sensitive, but it's important to talk about amputation.
Amputations, it's a life-changing event, to say the least.
It is, and it's usually a last resort when a limb is severely damaged, beyond repair. Things like trauma from accidents, complications from diabetes, severe infections, or even things like advanced osteomyelitis we talked about earlier.
Right. I'm curious about phantom limb pain. How can someone feel pain in a limb that's no longer there?
It's a fascinating phenomenon. We don't fully understand it, but it seems to be related to changes in the brain after an amputation. The brain still has those pathways, those memories associated with the missing limb.
And those pathways can misfire.
They can, creating the sensation of pain, even though the limb isn't there. It really shows that connection between the brain and the body. And after an amputation, that post-operative care is so crucial.
What does that typically involve?
It's multifaceted. You've got pain management, preventing infection, wound healing, helping the patient adjust to life with an amputation.
All right, it's a physical and emotional journey.
It is, and it can be a long one.
Okay, let's talk about a condition that many people might be familiar with. TMJ, temporomandibular joint disorder.
TMJ, I've heard of it. What causes it?
Well, TMJ isn't just one thing. It's a whole group of problems that affect that joint, the one that connects your jaw to your skull.
And we use that joint for a lot, right? Talking, cheering.
All the time. And when it's not working right, it can cause pain, clicking or popping sounds, difficulty opening your mouth. And the causes, well, they're all over the map.
The source material lists trauma, stress, teeth grinding, even arthritis.
And what's interesting is that a lot of these things lead to muscle tension or inflammation in that joint, which then causes the TMJ symptoms. So stress can lead to clenching or grinding your teeth, which puts pressure on the joint.
Exactly. And arthritis, it causes inflammation in the joint itself. It's all connected.
I had no idea there was such a strong link between TMJ and teeth grinding, that bruxism thing. Definitely something to be mindful of. Speaking of things to be mindful of, let's talk about carpal tunnel syndrome. It seems like everyone's got it these days.
Carpal tunnel. It's a classic example of how repetitive motions can really affect our bodies. It happens when that median nerve, the one that runs through a narrow passage in our wrist, gets compressed.
A carpal tunnel, right?
Yep, that's the one. And when that nerve gets compressed, it causes problems in your hand.
The source mentions that it affects the thumb, index, middle, and part of the ring finger, but not the pinky. Why is that?
Because the pinky finger is controlled by a different nerve, the ulnar nerve, which runs through a different tunnel. So the carpal tunnel compression affects those specific fingers, but spares the pinky.
So if your pinky's fine, it's probably not carpal tunnel.
Well, it's not a foolproof diagnosis, but it's a good clue. And besides that, you've got pain, numbness, tingling, weakness in those affected fingers. Often worse at night or after you've been using your hands a lot.
Like, say, typing on a computer all day.
Exactly. A lot of people also feel clumsy, have trouble doing things that require fine motor skills.
Yeah, that sounds familiar. Okay, let's move on to a condition that has a bit of a reputation for being associated with, shall we say, indulging a bit too much. Gout.
Gout. It's not just about overindulging, although diet can play a role. It happens when there's a buildup of uric acid in your blood. And that leads to these sharp, needle-like crystals forming in your joints.
Ouch. The source material actually uses the phrase needle-like crystals, and it made me cringe.
It's incredibly painful. And there's a connection to something called purine metabolism.
Purine metabolism. Break that down for me.
Purines, they're natural compounds found in food. When your body breaks them down, it produces uric acid. If your body makes too much uric acid or can't get rid of it efficiently, it builds up, and those painful crystals form in your joints.
So watching what you eat is important if you're prone to gout. What are some of the foods to be mindful of?
Well, the usual suspects are red meat, organ meats, seafood like shellfish and anchovies. Some vegetables, like asparagus, mushrooms, and peas, can also be high in purines. Moderation is key.
Good to know. And the source mentions two medications for gout, allopurinol and colchicine. How do those work?
Allopurinol helps lower uric acid levels in your blood over time, prevents future attacks. Colchicine is more for treating acute attacks, reducing the inflammation and pain.
So one for prevention, one for damage control.
You got it. Now, let's switch gears to something you might encounter if you spend time outdoors, especially in wooded areas. Lyme disease.
Lyme disease. It's spread by ticks, right?
Black-legged ticks, specifically, sometimes called deer ticks, and if it's not treated early, it can cause a whole range of symptoms affecting your joints, your heart, even your nervous system.
The source material mentions some pretty serious long-term consequences if it's not caught early.
Yeah, if that initial infection isn't treated, Lyme disease can progress. You can have persistent joint pain and swelling, neurological problems like facial paralysis, even heart issues like an irregular heartbeat.
That's scary stuff. And there's that bullseye rash, right?
Right, erythema migrans, it's called. A distinctive red rash that often appears at the site of the tick bite. It starts small, then expands, creating a larger ring with a clear center.
So if you see that, it's a pretty good indication of Lyme disease.
It's a strong clue, yes. And the good news is, Lyme disease can usually be treated effectively with antibiotics. Doxycycline, amoxicillin, those are common ones.
The source does mention a caution with doxycycline, though.
Right. Doxycycline isn't recommended for young children. It can cause discoloration of their teeth.
Important to know. Now, before we move on to diagnostic tools, there are two techniques mentioned in the source that I'm curious about. Log rolling and TED hose. Can you shed some light on those?
Log rolling. It's a technique used to move someone who might have a spinal injury. The key is to keep their spine stable, prevent further damage.
Sounds delicate.
It is. It involves a team of people working together to carefully roll the person as a single unit, hence the name log rolling. And TED hose. Those are compression stockings often prescribed to people at risk of blood clots.
Right, we touched on those earlier. But the source mentions they're also used for people who are non-ambulatory, meaning they can't walk or move around freely. Why is that?
It all comes back to circulation. When we walk, our calf muscles help pump blood back up to the heart. If someone can't walk, those muscles aren't doing their job as effectively.
So TED hose help compensate.
Exactly. They provide that gentle squeeze, promoting blood flow, preventing it from pooling in the legs.
Okay, I'm starting to see how understanding the mechanics of the body can lead to effective interventions.
It's all connected.
All right, let's dive into the world of diagnostic tools, where doctors become detectives using technology to figure out what's going on inside the body. We've already talked about some imaging techniques, X-rays, nuclear scans, MRIs, CT scans. What are some other tools in the arsenal?
Let's start with arthroscopy, which we touched on briefly earlier. It's like having a tiny camera crew broadcasting live footage from inside your joint.
Right, that little explorer navigating your joints.
Arthroscopy is more than just a viewing tool. It can diagnose and treat a variety of joint problems. Doctors can use it to see if there's damage to the cartilage, ligaments, tendons, and they can even use tiny instruments inserted through the arthroscope to repair torn tissues, remove fragments, or smooth out rough surfaces.
So it's both diagnostic and therapeutic.
Two birds, one stone. Now, what about when the problem isn't just in the joint, but in the nerves and muscles themselves? That's where a test called electromyography, or EMG, comes in.
EMG, that's the one with the needle electrodes, right?
Yep. It measures the electrical activity of your muscles and the nerves that control them. And yes, it involves inserting a thin needle electrode into the muscle being tested.
I'll admit, that part always makes me a little squeamish.
I get it, but it's not as bad as it sounds. The needle acts like a tiny antenna, picking up those electrical signals your muscles produce as they contract. Those signals are then displayed on a screen, and doctors can analyze the pattern.
So they're basically listening in on the communication between your nerves and muscles.
Exactly. It helps determine if there's nerve damage, a muscle problem, or an issue with the signals between them.
It's amazing how much information can be gleaned from electrical signals. We've explored a lot of different diagnostic tools: X-rays, nuclear scans, MRIs, CT scans, now EMG. How do doctors decide which test is best for a particular patient?
Well, it depends. They consider the patient's symptoms, their medical history, the suspected condition. They also weigh the risks and benefits of each test, and even things like cost and availability.
It's not a one-size-fits-all approach.
Not at all. It's about choosing the right tool for the job to get the most accurate information and make the best decisions about treatment.
Speaking of treatment, let's finish up this part of our deep dive with something that's a staple in most first aid kits, the ACE bandage.
Ah, yes. The trusty ACE bandage. A simple tool, but surprisingly versatile.
What's the proper way to use one? The source material mentions something about spiral and figure-8 patterns.
All right. The technique is important because you want to provide the right support and compression without cutting off blood flow. The spiral pattern is usually for cylindrical areas like the forearm or calf. Figure 8 is for joints like the ankle or knee.
So it's a bit of an art form, getting that wrap just right.
It is. A little practice goes a long way.
Okay, before we wrap up this part of our deep dive, I just want to acknowledge the last bit of information in our source material, skull bone terminology.
Ah, yes. The intricate framework that protects our most vital organ. We could do a whole deep dive just on that.
Maybe another time. We've covered so much ground today. Assistive devices, injuries, inflammatory conditions, degenerative conditions, and a whole array of diagnostic tools.
And we've only just scratched the surface. It's a testament to the complexity and the wonder of the human body.
Absolutely. And it's a reminder that we're not just passive passengers in these bodies. We have the power to learn about them and to care for them, to make choices that support their health and well-being.
Knowledge is power, as they say.
Exactly. So stay curious, keep exploring, and we'll catch you on the next part of our deep dive.
It really is incredible how this system, allows us to do so much. Move, dance, create. It's all thanks to the musculoskeletal system.
It's easy to forget how much we rely on it until something goes wrong. We were talking about TED hose earlier for preventing blood clots. The source material also mentions that they're often used for people who are non-ambulatory, meaning they can't walk around. Why would that be?
It's all about keeping that blood flowing, right? When we're up and walking, our calf muscles, they act like a secondary pump, helping push blood back up towards the heart.
Okay, I see where you're going with this.
But if someone's not moving around, those calf muscles aren't doing their job as effectively. And that's where TED hose come in. They provide that external compression, mimicking what those calf muscles would be doing.
So they're kind of like a stand-in for those hardworking calf muscles.
Exactly. Keeping the blood moving, preventing it from pooling in the legs. Simple solution, but really effective.
Okay, before we move on to the diagnostic tests, I wanted to circle back to a couple of techniques we talked about earlier. Log rolling and TED hose.
Oh yeah, log rolling and TED hose. What about them?
Well, the source material on log rolling really emphasizes the importance of teamwork and coordination. Why is that so crucial?
Imagine someone's had a fall, maybe injured their spine. Any twisting or bending could make things worse, right?
Right.
So log rolling allows a team of caregivers to move the person as a single unit, keeping that spine aligned and protected. It takes practice, coordination. It's a delicate maneuver.
A carefully choreographed rescue mission.
You could say that. Now, TED hose. We talked about their role in preventing blood clots, but the source also mentions they can help reduce swelling in the legs.
How does that work?
Compression. That gentle pressure from the TED hose, it helps push fluid back into the circulatory system, preventing it from building up in the tissues and causing swelling.
So it's not just about blood clots, it's also about managing swelling.
Right. Especially for people who might have limited mobility.
Okay, that makes sense. Now let's dive into the world of diagnostic testing. We've already talked about some imaging techniques, X-rays, nuclear scans, MRIs, CT scans. What are some of the other tools doctors use to figure out what's going on?
Well, we talked about arthroscopy earlier. Remember that tiny camera exploring the joint?
Yeah, like a live feed from inside the body.
It's more than just looking around, though. Doctors can use arthroscopy to diagnose and treat a whole range of joint problems. They can see if there's damage to the cartilage, ligaments, tendons, and they can even use tiny instruments inserted through the arthroscope to repair tissues, remove fragments, smooth out rough surfaces.
So it's both diagnostic and therapeutic.
Exactly. A minimally invasive way to address a lot of joint issues.
Now, what about when the problem is not just in the joint, but in the nerves and muscles? What kind of tests are used for that?
One common test is electromyography, EMG. It measures the electrical activity of your muscles and the nerves that control them.
All right, we talked about EMG earlier, the one with the needle electrodes.
Yes. A thin needle is inserted into the muscle, and it acts like a little antenna, picking up the electrical signals the muscle produces as it contracts.
So they're essentially eavesdropping on the communication between the nerves and muscles.
But in a way, yes. And by analyzing those signals, doctors can figure out if there's nerve damage, a muscle problem, or a problem with the signals between them.
It's amazing how much information can be extracted from electrical signals. So we've got all these different diagnostic tools, X-rays, nuclear scans, MRIs, CT scans, EMG. How do doctors decide which one is best for a particular patient?
It's about choosing the right tool for the job, right? They consider the patient's symptoms, their medical history, what condition they suspect. They also look at the risks and benefits of each test, even things like cost and availability.
So there's no one-size-fits-all approach.
Not at all. It's about finding the best way to get the information they need to make an accurate diagnosis and come up with the best treatment plan.
It's a reminder that medicine is both a science and an art.
Absolutely. It requires knowledge, skill, and a bit of intuition.
Okay, we've covered a lot of ground today. The mechanics of the musculoskeletal system, the things that can go wrong, the ways we can support it, the tools doctors use to diagnose and treat problems. I feel like I've learned so much.
It really is a fascinating system, isn't it? So intricate, so complex, yet so essential to our everyday lives.
And it's a reminder that we have a role to play in keeping it healthy. We're not just passive passengers in these bodies. We can learn about them, care for them, make choices that support their well-being.
It's about taking ownership of our health.
Exactly. Now, before we move on to the final part of our deep dive, I want to leave our listener with something to think about. We talked about amputations earlier and the phantom limb pain that can occur. But what about the future of prosthetics?
Ah, yes. Technology is advancing so rapidly. We're seeing prosthetics that are more sophisticated, more lifelike than ever before.
It's not just about replacing a missing limb anymore. We're talking about prosthetics that can be controlled by thought, that can provide sensory feedback, that are almost indistinguishable from natural limbs.
It's incredible. But it also raises some interesting questions, doesn't it?
It does. If we can create prosthetics that are functionally equivalent to or even better than natural limbs, does that change how we define disability? Does it open up possibilities for human enhancement?
Big questions to ponder. And it reminds us that scientific progress often comes with ethical and philosophical considerations.
It's not just about the technology itself, but how we use it and what it means for our understanding of ourselves and our place in the world.
Well said. It's a holistic view of human nature that we should always keep in mind, even as we marvel at these technological advances.
Well, on that note of pondering the big questions, let's take a short break. We'll be back soon for the final part of our deep dive into the musculoskeletal system. Welcome back to the deep dive. We've been on quite a journey exploring the musculoskeletal system, from the mechanics of movement to the complexities of disease and the incredible world of diagnostic technology.
It's really amazing, isn't it, how this system allows us to do so much, to interact with the world around us.
It truly is. And as we wrap up our exploration, I'm realizing that even after all this, we've only scratched the surface. There's always more to learn about the human body, isn't there?
Oh, absolutely. The field of musculoskeletal health is constantly evolving. New discoveries, new innovations all the time. It's a really exciting area to be in.
So as we leave our listener with some final thoughts, what's the key takeaway you hope they'll remember from this deep dive?
I think the biggest takeaway is that knowledge is power when it comes to your health. Understanding your body, knowing how it works, what can go wrong, that empowers you to take care of yourself.
It's not about becoming a medical expert, right?
No, not at all. It's about having that basic understanding so you can make informed choices, recognize when something's not right, and know when to seek help.
It's about being an active participant in your own health journey.
Exactly. It's your body, the vessel that carries you through life. It's what allows you to experience the world, to move, to create. It deserves to be treated with respect, care, and a healthy dose of curiosity.
I love that. Treat your body with respect, care, and curiosity.
Yeah.
What a great way to sum it up.
So keep exploring, keep asking questions. The journey of discovery never really ends.
And on that note of ongoing exploration, we'll bid you farewell for now. Thanks for joining us on this deep dive into the musculoskeletal system.